Hi, how are you? My name is Rachel. I'm going to be your student nurse today. Let me provide for some privacy. I'm going to come over here and wash my hands since we've already got your vital signs. What's your name?
Christina Bresson,
Okay, and what is your date of birth?
9/17/1996.
Okay, let me just verify that by your name tag. Great. Okay, so I'm going to be doing a head-to-toe assessment on you today. Are you comfortable with that?
Yes.
All right, my first question is, do you know where you're at right now?
I'm at the hospital.
Okay, do you know the date?
It's August 21st, 2017.
Okay, and who is the president?
Donald Trump.
Okay, speech is clear and articulate. Hygiene is good. Posture is good. Okay. Just checking your head. There's no bumps, lesions, or parasites noted. That's good. I'm going to test for your facial sensation. So go ahead and close your eyes and tell me where you feel my finger.
Forehead, left cheek, chin, right cheek.
Okay, now go ahead and smile and raise your eyebrows. Okay, cranial nerves 5 and 7 are intact. I'm just looking at your eyes. There's no redness or discharge noted. All right, and just look straight at me. Pupils are equal and reactive to light and accommodation. Cranial nerve 3 is intact. I'm going to have you follow my finger with your eyes only. Okay, now follow the tip to your nose. Okay, cranial nerves 3, 4, and 6 are intact. Now I'm going to have you cover one eye, the same as what I'm covering, and tell me when you can see my fingers wiggling.
Wiggling. Wiggling. Wiggling.
Okay, other eye.
Wiggling. Wiggling. Wiggling.
Okay, cranial nerve 2 is intact. I'm going to have you cover one nostril. Take a deep breath. Okay, perfect. Cover the other nostril. Take a deep breath. Perfect. No signs of nasal patency. Go ahead and lean your head back for me. Okay, no lesions or discharge noted. No deviations in shape. That's great. Okay, go ahead and look down. I'm going to have you open your mouth now. Stick out your tongue and say ah. Okay, now move your tongue side to side. Perfect. Now take a swallow. Okay, no abnormalities noted to general dentition or mucous membranes, and cranial nerves 9, 10, and 12 are intact. Okay, now I'm going to check your ears. No cerumen or lesions noted. Perfect. No cerumen or lesions noted in this ear either. Now I'm going to check your hearing, so what I'm going to have you do is close your eyes for me. If you hear a sound, let me know what ear it's in.
Left. Right.
Okay, cranial nerve 8 is intact. Now I'm just going to palpate your lymph nodes. We've got the submental, submandibular, tonsillar, preauricular, postauricular, anterior cervical, posterior cervical, occipital. Okay, now fingers. Okay, supraclavicular, and no abnormalities noted. Okay, so thorax ratio is 1 to 2, AP to lateral. Breaths are even and unlabored. I'm going to walk back here. All right, and I'm going to put my hands right here. Take a deep breath. Thoracic expansion is even and symmetrical. Can you go ahead and give yourself a hug for me? Bend over just a little bit. Perfect. I'm checking your spinal alignment. Spine is erect. Perfect. Okay. I'm going to put my hand right here, and I'm going to have you tell me if you feel any tenderness.
Nope.
Nope. Okay.
No.
Nope. Okay. No costovertebral angle tenderness, so that's great. Now I'm going to have you say 99.
99. 99. 99.
Okay, no abnormalities with vocal frondus. That's great. So now I'm going to listen to your breath sounds. So when you feel my stethoscope, just take a deep breath. Perfect. arm up for me. Okay, other arm. Perfect. Now I'm going to come around the front. Okay, breath sounds are even and unlabored. Okay, I'm going to feel your carotid pulses. Carotid pulses are even and strong. Now I'm going to listen to your heart sounds. Okay, got the aortic pulse, which is at the right second intercostal space. Got the pulmonic pulse, which is at the left second intercostal space. Erb's point, which is at the third left intercostal space. Tricuspid, which is at the fourth left intercostal space. And mitral, which is at the left fifth intercostal space. Okay, so now I'm going to have you lay down for me. Good. Abdomen is flat. I'm going to listen to your bowel sounds. And I'm starting in the right lower quadrant. Upper right quadrant. Upper left quadrant. And lower left quadrant. Okay, perfect. Now I'm just going to push on your stomach a little bit. Let me know if you feel any tenderness. In the lower right quadrant?
No.
Upper right quadrant?
No.
Upper left quadrant?
No.
Lower left quadrant?
No.
Okay. No tenderness upon palpation and no distension noted. No other abnormalities noted. When was your last bowel movement?
Yesterday.
Yesterday. Was there anything wrong with that? Everything good?
Yes.
Okay. Do you have any problems urinating, incontinence?
No.
Anything? Okay, great. All right, so now I'm going to grab you a little bit more and just let me know if you feel any tenderness.
No.
Nope.
No.
Nope. 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 Okay. No tenderness, no edema, skin is warm and dry, and no other abnormalities noted. All right. So now I'm gonna test your capillary refill. You take your socks off?
Yes.
Okay. That's fine. Let's listen. Yes. Okay. Just gonna slip your socks off real quick. Okay, capillary refill is less than 3 seconds, which is normal, so that's good. So now what I'm going to have you do is go ahead and sit up for me. Okay, and hop off the chair. Put your hands by your side. Close your eyes for me. All right, now open them. All right, Romberg test is negative. I'm going to have you take 3 steps towards me. All right, turn around and take 3 steps back. Gait is normal. Hop up back on the chair for me. Okay, so now what I'm going to have you do is take your arms like this and make a big circle. All right, now go backwards. And do the same thing but with your feet. Perfect, now other way. Okay, now take your head and do the same thing. Okay, range of motion is even and no abnormalities noted. All right, put your hands out front like this for me. And push against my hands. Perfect. All right, legs out for me. Push against my hands. Perfect. And perfect. Strength in extremities is strong and even. I'm gonna put my hands up here, shrug your shoulders. Perfect. Now push against my hand. Great. Do the same thing. All right. Cranial nerve 11 is intact. Now I'm going to test some of your reflexes. I'm going to start with the patellar. Oh, good. Okay. Alright, now I'm going to come up here and do the triceps. Perfect. Perfect. Alright, let me see your hand. Now we're doing the biceps. Perfect. Now let's do the brachioradialis reflex. It's going to be about here and here. Those are all even. Now I'm going to come down here and do the Achilles reflex. Perfect. Perfect. Okay, now the plantar reflex. I'm going to take my pen light and doop. Good. Doop. Okay. Now I'm going to test for ankle clonus. So I'm just going to relax your leg. I'm going to do a couple of swirls like this and perfect. Don't break my foot. Oh, very good. Okay, perfect. No abnormalities noted. Right now I'm going to feel for your pulses. We've got the radial pulse. Radial pulse is even and strong. Got the brachial pulse. Brachial pulse is even and strong. Got the popliteal. The popliteal pulse is even and strong. Got the dorsalis pedis pulse. Dorsalis pedis is even and strong. We've got the posterior tibial pulse. Posterior tibial pulse is even and strong. All right, so we're all done here. You have a call button. You've done really good today. Just let me know if there's anything I can do for you to help you out. I'm gonna come over here and wash my hands, then I'm gonna give my findings to the doctor.